So thank you guys for logging in today and being here for this presentation. This is a project that I'm really excited about, and I love sharing it with people. So thank you for being here. My name is Mina Motakhaveri. I'm a fourth-year medical student at the University of Mississippi Medical Center in Jackson. And this is my presentation, Breaking Bread and Barriers, Cultivating Solutions for Mississippi Food Deserts. Myself and all of the other authors have no financial disclosures to report. So the way I kind of want to go about this presentation is first we'll talk about the objectives that I want to hit. The main one being defining our problem, and that is what are food deserts and what is food insecurity and how prevalent are these issues in our community? Why should we care about this? And then I'll introduce our intervention tool. And then I'll talk about how we quantitatively and qualitatively measure the impact of that intervention tool. Okay, so next slide, please. So food insecurity and food deserts, we're going to go over some definitions real quick. Food insecurity is having an uncertain availability or ability to acquire nutritionally adequate foods. Food deserts are defined as areas that have limited access to fresh, affordable, and healthy foods. That usually means that people in those areas will be eating heavily processed foods with a long shelf life. So a bit more details about what those areas are defined as. 33% of residents living greater than 1 mile from a grocery store if we're talking about an urban area, or for a rural area, 33% of its residents living greater than 10 miles from a grocery store, and then 20% or more of an area's residents living at or below the poverty line. So in the United States as a whole, 6% of our population lives in a food desert, which is higher than it should be. So when we talk about Mississippi specifically, I'm sure you can start thinking in your mind what sort of numbers Mississippi might have. Are they going to have higher or lower? And Mississippi actually has the highest percentage of its population residing in food deserts. Mississippi has 31%, which is an incredible jump from the national average, and overall can greatly impact many areas of a person's life and their overall health, which is not a big stretch of the imagination as to why that is. Poor diet and obesity are two risk factors that are modifiable in a person's life for the development of cardiovascular disease. And this is really important because cardiovascular disease is the leading cause of death in the nation. And again, Mississippi ranks first in the country for cardiovascular disease mortality. So as we can imagine, initiatives aimed at increasing awareness of cardiovascular disease, its risk factors, and educating the community as well as promoting healthier lifestyles are really, really important to the well-being of the residents of Mississippi, as well as residents of anyone living in food insecurity or in a food desert. So, okay, next slide, please. So now I'll talk a little bit about our intervention tool. Our intervention tool, it's actually a collection of recipes that were constructed by students at UMMC, at my medical school. Every recipe is screened and edited by registered dietitians, so it has some validity as to why it's in the book. It also includes tips and education on cooking and nutrition as well on each page. We have also expanded this project to receive recipe submissions for undergraduate students at 6 universities across the state through ambassador programs. So this also encourages pre-med students to take an early interest in preventative medicine and nutrition as well before they even get into medical school. But the thing that really makes this book unique is that all of the ingredients for all of the recipes are sourced from dollar stores. And this is very, very important because there are about 6 times more dollar stores in the state of Mississippi than the most prevalent leading grocery store chain. So this makes this a resource that is much more accessible to people experiencing food insecurity in terms of cost and accessibility. The recipes that we create include snacks and drinks, breakfast, lunch, and dinner, all with the goal of being low cost, firstly, being quick to make, so not having to spend a lot of time putting these things together. As you can see in our table, we have a breakdown of the average cost, calories, and time for preparation. But we also want them to be tasty and interesting because we want people to become intrigued, and maybe it can reach people that are interested in making a healthy change, but they need a place to start. So we want to give them something that actually makes them want to start those changes. The way that we distribute this resource is at free community health screening events done by the students at the university all across the state, as well as at our local student-run free clinic here in Jackson called the Jackson Free Clinic. We distribute it through physical printed copies, of which we have done over 100, as well as electronic copies via QR code. And when I uploaded this presentation, it was 442, but now it's a bit over 600 scans. And at JFC, we also periodically do recipe demonstrations for patients that are in the waiting rooms. So they do get to sample the food and learn about the resource. And that's been a great tool to like get people engaged and get them to want to try things for themselves at home. So in order to get data on our community and the possible impact that this resource might have, we distribute short surveys for during the food demonstrations at the Jackson Free Clinic. Part of it is the U.S. Household Food Insecurity Survey module. It's done by the USDA. It's just 6 short questions done like kind of in a scale format. And some important data that we learned from that is that many of the residents that took this survey reported food insecurity. 73.5% of them sometimes are often running out of food, and over 50% limiting their food consumption due to financial restraints. We also added some of our own questions in as well about their eating habits and likelihood of using our resource at home after they've learned about it and tried the recipes. And some notable results from our questions, we found that 38% of our sample reported that they eat fast food at least once a week, and the majority of that subset eats it daily. However, 83% reported that they would use the recipe book at home in some capacity. They also reported that the largest barrier to them eating healthy is cost right now, which this resource does help to mitigate. For future data, we would like to implement some sort of method to examine health outcomes of using this tool consistently. That's something we want to do when we get more resources available to us. Okay, we can go to the next slide. So the conclusions that I would like everyone to glean from this: if you live in a food desert, you're often restricted to consuming foods that have a long shelf life and lack accessibility to fresh fruits and vegetables. And this is something that anyone who's a healthcare provider should be aware of and consider. Think about these barriers to modifying a person's lifestyle, especially the cost. That was the #1 barrier we found with our sample. Oh, I'm sorry, was there a question? Oh, okay. So we want to think about these things when we're making recommendations to patients, not just eat healthier. It's, well, how can I do that? Where do I start? Those are important things to think about when you're talking to patients. So providing low-income individuals, people that live in food deserts or experiencing food insecurity, with the food demonstrations and affordable recipes using the ingredients sold at local dollar stores can help mitigate a lot of these obstacles imposed by practicing a healthy diet. And lastly, working with patients directly to overcome a barrier that is tangible, something that they can work on and something that you can help them with, that leads to a better quality of life, that can help increase trust and partnership in the patient-physician relationship, which leads to more effective overall patient care. And so our last slide, these are just my references and just some photos from some of the recipes we have in the book. And if any of you want the QR code flyer to this, please email me and I will send it to you. It's totally free. It doesn't have to be just for patients in Mississippi. We want as many people to see this as they want to. You can send it to your patients. I use it for myself a lot. So please email me if you're interested in looking at that.